Hi everyone, I'm Sarah from the Spoonie Life and Beyond. Welcome to my channel and thank you for joining me. So today we're going to be doing a deep dive into type 1 diabetes as requested by one of our subscribers. So I'm just going to let you know I am actually visually impaired, so if you see me not looking at the camera, I do apologize. And also I do follow text to voice, so sometimes I may pause or stutter a little bit. And I'm also not a medical professional, so what I'm saying today is for awareness purposes and should not be taken as medical advice. Okay, so I'm just going to jump into it in a moment. Just wait for some people to jump on. So there is a lot of information out there about type 1 diabetes, like the Mayo Clinic, for example. There is a lot of information out there that also has information from endocrinologists. So we'll jump into it now. So what is type 1 diabetes? So type 1 diabetes was once known as juvenile diabetes, or insulin dependent diabetes. It's a chronic condition. In this condition, the pancreas makes little or no insulin. Insulin is a hormone the body uses to allow sugar or glucose to enter cells to produce energy. So different factors such as genetics and some viruses may cause type 1 diabetes, although type 1 diabetes usually appears during childhood or adolescence. It can sometimes develop in adults. So some of the symptoms of diabetes, type 1 diabetes, can appear suddenly, and they may include but aren't limited to feeling more thirsty than usual, urinating a lot, bedwetting in children who don't usually wet the bed during the night, feeling very hungry, losing weight without trying, and the weight loss can actually be very rapid, and can look quite gaunt in the face. Feeling irritable and having other mood changes as well. Feeling tired and weak. Sorry, I do apologize. So feeling tired and weak or having blurry vision. So if these things happen, please do go and see a doctor. So the causes, the cause isn't for type 1 diabetes isn't 100% known. So usually it's the body's own immune system, which normally fights harmful bacteria and viruses and toxins. It ends up destroying the insulin producing or islet cells in the pancreas. Other possible causes include genetics, exposure to viruses and other environmental factors. So the role of insulin. So once a large number of islet cells are destroyed, the body will produce little or no insulin. So insulin is a hormone that comes from a gland behind and below the stomach, known as the pancreas. So the pancreas puts insulin into the bloodstream. So insulin travels through the body, allowing sugar to enter the cells. Insulin lowers the amount of sugar in the bloodstream. So as the blood sugar levels drop, the pancreas puts less insulin into the bloodstream. So the role of glucose. So glucose, a sugar, is a main source of energy for the cells that make up muscles and other tissues. So glucose comes from two major sources, food and the liver. So sugar is absorbed into the bloodstream where it enters cells with the help of insulin. The liver stores glucose in the form of glycogen. So when glucose levels are low, such as when you haven't eaten in a while, or the liver breaks down the stored glycogen into glucose, this keeps glucose levels within a typical range. In type 1 diabetes, there is no insulin to let glucose into the cells. Because of this, the sugar builds up into the bloodstream, and this can cause life-threatening complications. So type 1 diabetes is quite serious. So some factors that can raise your risk for type 1 diabetes include family history. So anyone with a parent or sibling with type 1 diabetes has a slightly higher risk of developing the condition. So there is the genetics. So having certain genes increases the risk of developing type 1 diabetes. Geography, the number of people who have type 1 diabetes tends to be higher as you travel away from the equator. So age, type 1 diabetes can appear at any age, but it appears at two noticeable peaks. So the first peak occurs in children between 4 and 7 years old, and the second is in children between 10 and 14 years old. So some of the complications over time, type 1 diabetes complications can affect the major organs in the body. These organs can include the heart, blood vessels, nerves, eyes, and kidneys. And having a normal blood sugar level can lower the risk of many of the complications. So trying to keep it under control and keeping on top of it. So diabetes complications can lead to disabilities or even threaten the person's life. So heart and blood vessel disease. Diabetes increases the risk of some problems with the heart and blood vessels. These include coronary artery disease with chest pain, also known as angina, heart attacks, stroke, narrowing of the arteries, and high blood pressure. So nerve damage, also known as neuropathy. So too much sugar in the blood can injure the walls of the tiny blood cells, blood vessels, also known as capillaries, that feed the nerves. This is especially true in the legs. So this can cause tingling, numbness, burning or pain. This usually begins at the tips of the toes or fingers and then spreads upwards. And poorly controlled blood sugar can cause you to lose all sense of feeling in the affected limb over time. So you may find some people who have had type 1 diabetes for a very long period of time have gone through periods of time where they have not had control of their diabetes, and you know, they have over time ended up having problems with numbness in their feet or their legs, and therefore they end up getting ulcers, skin ulcers, and they don't know about it, and it can become infected. You know, and people with type 1 diabetes are at a higher risk of infection. They don't heal as well as others, so that needs to be taken into account as well. So they can also get damage to the nerves that affect the digestive system, which can cause problems with nausea, vomiting, diarrhea, or constipation. And there can also be for men erectile dysfunction as well. So with the kidney damage, the kidneys have millions of tiny blood vessels that keep waste from entering the blood. So diabetes can damage this system. Severe damage can lead to kidney failure or end-stage kidney disease that can't be reversed. End-stage kidney disease needs to be treated with mechanical filtering of the kidneys, also known as dialysis, or a kidney transplant. There can also be eye damage. So diabetes can damage the blood vessels in the retina, part of the eye that senses light. So it's also known as diabetic retinopathy. So this could cause blindness. So diabetes also increases the risk of other serious vision conditions such as cataracts and glaucoma. So there is also, as I said before, the foot damage. So nerve damage in the feet or poor blood flow to the feet increases risk of some foot complications, which if left untreated, like cuts and blisters, can become serious infections. These infections may need to be treated with toe, foot or leg removal or amputations. So it is quite serious. Skin and mouth conditions. Diabetes may leave you more prone to infections of the skin and mouth. These include bacterial and fungal infections. So gum disease and dry mouth are also more likely. So with pregnancy, there can be complications with high blood sugar levels being dangerous for both the mum and the baby. So there is a risk of miscarriage, stillbirth or birth defects increasing when diabetes isn't well controlled. So for the parent, diabetes increases the risk of diabetic ketoacidosis, diabetic eye problems, pregnancy-induced high blood pressure and preeclampsia. So that's when we need to talk about prevention. So there's no known way to actually prevent type 1 diabetes, but researchers are working on preventing this disease or further damage of the islet cells in people who are newly diagnosed. So if you're newly diagnosed, this may be something that you can talk to with your medical practitioner or your endocrinologist. And I'm also now going to speak just very quickly in regards to that I have personally in my personal life cared for 2 people with type 1 diabetes, one being an adult and one being a teenager. The teenager who was actually diagnosed at the age of 5. But the teenager came into my life just as a preteen. So, there's lots of ways of trying to treat it. So, there's the insulin that you take once a day, which lasts for 24 hours. And then you can have the insulins as well that you take on a regular basis during the day to try to control your sugar levels. And there's different ways that endocrinologist does it. It's different for each person. So some people have set doses for set times of the day. Other people do what's known as carb counting. So with each meal, they check their blood sugar level, they check how many carbohydrates are in the meal, and then they're actually given a chart and it tells them how many units of insulin that they need to inject themselves with. And every so often, usually every 3 months, 3 to 6 months, they'll go in and see their endocrinologist, who will do a blood test for HbA1c. And that actually tells them the average sugar level over a period of 3 months. So it kind of tells them how well the person has been treating their diabetes or having control of their diabetes, and if there needs to be any adjustments or trying different things, and also having those things in hand with type 1 diabetes of having hypoglycemic kits as well. So when going out, having something to boost the sugar levels, and then a carbohydrate and a protein or something to follow up just to keep the sugar levels up. And it does affect lives, especially in respects to teenagers, because it can affect some of the things that they do compared to some of the things their peers can do. So especially when it comes that time where they become legal age, like here in Australia, they can start drinking legally at the age of 18. And with type 1 diabetics and alcohol, it's very, very difficult to be able to safely control your sugar levels whilst consuming large amounts of alcohol. So it does affect that. Also, with getting a driver's license, you have to go to an endocrinologist and show that you are actually able to keep your sugar levels stable, so you're not a risk when you are driving. So you know, it may cause delays to getting your driver's license, so their friends may be getting their driver's license before they are. You know, there is a lot of differences for teenagers when they're going through type 1 diabetes, and it is really hard. And you know, we in the situation that we were in, we found that seeing a counsellor helped, and also a diabetes counsellor, so that they could be taught ways of safely being able to do these things with their friends, so they weren't left out. And also with sports, learning how to control sugar levels with sports, because you know, hypoglycemia, which is low blood sugar, can occur with certain exercises. It can basically cause the sugar levels to drop, and can drop quite rapidly. So usually having a snack beforehand and having a hypo kit nearby is usually helpful, just things like that. So, you know, there's so many different things that go into caring for type 1 diabetes, you know, that there isn't a textbook way of doing it. So that's basically the deep dive into type 1 diabetes. I'm doing deep dives a couple of times a week, and also looking for guest speakers. We've got a guest speaker coming up on Thursday, where we'll be talking about chronic illness and invisible disabilities, and it's a personal journey and experience. So if anyone would also like to have a deep dive on a particular disorder or disease, or, you know, chronic illness, disability, or invisible disease, pop a comment below or send me a message, and I'll definitely do the research and do a deep dive for you. And also, if you'd like to share your journey and be a guest speaker, send me a message, and I'd love to have a chat with you. So I will see you again on Thursday with our lovely guest speaker, Taryn. And then on Saturday, I will be doing a deep dive into lupus. So I shall see you in the next video. Thank you for your support, and don't forget to like, share, and subscribe. Bye.